Hello, Angela. How are you?
Good. How are you today?
Good. I'll call this special regional council meeting to order. Please be advised that today's meeting is available for the public to attend virtually, is being streamed and recorded. Can I get a motion, please, to adopt the agenda? Moved by Councillor Andrews, seconded by Councillor Roper. All those in favor? Carried. So, Angela, November 4th, I believe we had a presentation from Dr. Mostert regarding some concerns about how things were going at the hospital and his ability to provide good medical services to the people of the Northern Rockies. And after hearing what he had to say, I reached out to you to get your views on this and ask you to do a presentation to council regarding some of his concerns. And some comments. They've all frozen.
Yeah, I can still hear you.
I'm wondering if they're frozen.
Yeah, I think they are now because Scott hasn't moved.
Yeah, and I'm still here, so.
Okay, good.
I'll text ahead and see if I can let them know.
Oh, I see.
Just froze here, so we're just getting back. So, Angela, I don't know how much of that you got, but I was talking about we had received a presentation from Dr. Mostert about some concerns regarding his ability to provide healthcare at the hospital here. And I reached out to you, asked you for some comments on whether you would present to council, and you agreed to. So I'm asking you to comment on some of the things that Dr. Mostert had said, and principally some of the things around sterilization and our lab techs at the hospital are two very important areas of concern. There are many others, but those two are I think top of mind. So I'll get you to go ahead with your comments.
Yes, thank you, Mayor Foster and Council, for inviting us to provide some additional information in follow-up to the November 4th special meeting. And I'm just wondering, we did put together a presentation, and I don't know if Jaylene is able to put it on the screen for everyone.
Yep, I can do that. I was just going to see if you wanted to share yours, or I can share mine. I'll do it this way, and then you can just tell me when you want me to advance.
Okay. So yeah, you can advance.
Hold on. Sorry. Let's get it so that more than just me can see it. There we go. Okay. And let's do this. And let's get it to there. Okay.
There we go.
And I'm definitely not a good user of this software, so let's try and this is how we'll do it.
Okay, so as noted, the purpose of the presentation is to provide information and clarification regarding a number of the key operational topics that were discussed at the November 4th meeting. So the next slide. So the sterile processing department. So in 2019-2020, when the annual sterilizer service contract came up for renewal, the cost for that is $29,000 a year, and that doesn't include any expenses should the STERIS representatives need to come to Fort Nelson. The fact that the current autoclave sterilizer was installed in 2006, and the replacement cost is $60,000. We have a regional coordinator for all the medical devices, device reprocessing throughout Northern Health. And so Bonnie McKenzie came up and one of the other factors she looked at is how often is that sterilizer being used, and it's being used one load per week. And so there was a meeting in May of 2021 that brought together the local Fort Nelson physicians, Dr. Temple, Annette, and Bonnie, to talk about the current use, the age, and the recommendations. One of the things that we did find out through the review that had been conducted is that we are sterilizing more instruments for the private medical clinic than we are for the hospital, largely because a lot of instruments with infection control in this day and age are moving to disposable, but also with the different types of procedures that are being done in the Fort Nelson Hospital, we are doing less and less in the hospital for that. And then within the discussion, there's a good transportation route in terms of with number of trips that go back between Fort Nelson and Fort St. John. So in consideration of that, at our time, the understanding was that the physicians had accepted and were understanding of the reasons for both not renewing the service contract, as well as once the sterilizer became unfunctional, that we would not replace it. And just to note that we would not be decreasing the permanent position that's associated with that work because of the limited amount of work. And they are also do a lot of our ordering for supplies and restocking shelves. So we felt that that we wouldn't have to make any reductions. So I don't know, Mayor Foster, if do you want me to go through the presentation and then open it up for questions at the end?
Well, let's just stop there so we can discuss this one point, and then we'll go on to the next point. I've got a couple of questions. First of all, will the local doctors be able to use that transportation system, send their equipment down to Fort St. John to get sterilized and return it to Fort Nelson? Will that be available to them? And you said that currently the sterilizer at the hospital is being used one load per week. Is that correct? Am I understanding that right? Is the autoclave there is being used only once per week? Is that what I'm hearing?
That's correct. We're only doing one load a week because there isn't the volume or the need at this time to do more than that. Typically in private physician offices, they do their own sterilization, or they are physicians are able to bill MSP for tray fees. And so physicians either use disposables or I recall Dr. Moster talking about keeping their system going and all of the checks and balances that they needed to do to keep their system going. There is guidelines out there from the College of Surgeons and Physicians in terms of how to clean instruments should they need to do that. We could also look at what that would mean in terms of physicians sending instruments along with our instruments down to Fort St. John to be cleaned. They would have to be well labeled so that they don't, because of them being cleaned in a larger sterile processing department, so that we're not end up missing or reallocating the instrument somewhere else. But that is a conversation that we can have with them.
Okay, Councillor Andrews.
Do we know and of the use of the autoclave over the previous years, just with the services we don't provide and the lack of the hospitals being used because of people in there? I imagine that's why the autoclave is only being used once a week, whereas in past, I would imagine it would be used more. So if we're looking to get more services in our hospital, it's probably an important piece of equipment to maintain.
Yeah, so we did do a 2-year review, and that's where the findings were over the last 2 years. We were only using them for one load per week. The two main contributors to the workload are the emergency department And then the operating room, of which we only do a few operations a year when the visiting ENT clinic from the BC Children's comes up. So there has been a significant reduction, but similar to other programs in BC and Alberta, they are centralizing because these are very expensive. You have to run daily tests to make sure that they're sterilizing at the rate that they need to be sterilized, how we're processing them in terms of taking them out. This has been a shift that we've seen in other communities and throughout the province in terms of the centralization of sterile processing department.
Okay, thank you. Are there any other questions for Angela on this? Very well, Angela, I'll get you to continue with your presentation.
Thank you. So the next slide is in terms of the CT business case. So there was some discussion, and we want to recognize the strong advocacy work by Dr. Mostert and the local Fort Nelson physicians. And that has led to Northern Health making the decision to develop a business case. Any equipment that costs over $100,000, then we require a business case in order to fully understand the cost of the equipment. And some of it was discussed at the November 4th meeting in terms of requirements for lead-lined walls, renovation costs, what is the best scenario, providing a couple different options that then is discussed at the NH Capital Planning Working Group in terms of the best options, not just in terms of finance, but also in terms of location within the facility. And so we don't place capital equipment on the regional hospital district list without both doing the business case so that the regional hospital district understands the full costs and what we would be asking of them, as well as without NH Capital approving that business case. And so it is the Northern Health Diagnostic team that's leading out the business case. We are, as noted by Dr. Mostert, consulting with the Fort Nelson and the Haida Gwaii physicians in terms of the referrals that are coming out of their offices. And the Doctors of BC, which is a provincial group, does provide funding to physicians to support healthcare service improvement projects. So there's quite a number of different projects that are funded so that they don't have either out-of-pocket expenses for their clinic or for them if they're participating in a number of committees, those types of things, and taking time away from work. So that is a normal practice now in terms of improving in physician engagement, which is really well welcomed. So the business case is almost completed the data collection phase, and then once it's completed, it'll come to the Northern Health Capital Planning Working Group for funding considerations. And just to note that donations from the community are always welcome.
Thank you, Angela. How long do you think it'll be before the business case is completed, and how long does the next step take between the business plan and the capital planning works group to make a decision on funding?
I don't, Annette, were you given any timeline in terms of the business case completion?
No, when I reached out, they still are waiting on some another area for data, and there is not an established timeline yet.
Okay, and once we do have this data and it gets compiled, then it goes to the capital planning works group. Typically, how long does that take for consideration? Because one of the things we were worried about is that this is not on the capital plan for the regional hospital district. And we're wondering, we don't want this to be kicked down 4 years waiting for funding to come along. So can you give us some guidelines on how that's likely to happen?
So the annual cycle for major capital equipment, it occurs in January, February of each year. And so we would anticipate that the business plans for this would be completed, so that then the recommendations can go to this January, February, where we will be, Northern Health Authority reviews the over 100,000 and sets the priorities and moves forward from there.
So one of the reasons this CAT scan machine is so important is for patients who are the victims of stroke. And we don't have, because of the distance we are from major hospitals like Fort St. John and Prince George, time is extremely critical with stroke patients, as I'm sure you're aware. And this CAT scan machine, can save lives in the Northern Rockies. And I think it's imperative that we move swiftly to address this and get this installed as soon as possible. Councillor Gerwing, you had a question? Okay. Any other questions regarding the CAT scan machine? Very well, thank you. Angela, if you could move on.
So the next slide is regarding the lab services. And so there was some conversation about this, as you had noted, Mayor Foster. So the chief tech provided us notice on September 15th that she was leaving, with her last day of work being October 29th. And then the second lab tech also gave notice for her last day being October 29th as well. We happened on the September 16th, there was 2 meetings. One is Annette has convened monthly physician communication meetings, of which physicians meet with department heads in terms of services within the Fort Nelson Hospital, as well as community, and an opportunity for them to provide feedback and concerns or comments on services. So the notice of the chief tech was given at that time. And then as well that evening, there was a Fort Nelson Medical Advisory Committee meeting as well. So the physicians were also received notice then. And then the October 8th, it was also communicated at the community health planning meeting in terms of our current state of lab services. And as noted, the Facebook post to the public, and we're working on further communication to the public in terms of the impacts that they will experience when they come to the Fort Nelson Hospital. There was a series of meetings in September to October, that were led out by Annette, that included our regional team, the Northeast team, and the chief tech at that time, as well as physicians attended and were invited to all those meetings, as well as the Northeast medical lead, which is Dr. Azar, to develop and implement strategies to mitigate the impact. So individuals for outpatient routine lab work will not see an impact. The wait list is between 2 and 2.5 weeks in terms of being scheduled for routine lab work, which is within the normal parameters. And we've increased the transportation of specimens so that the physicians are able to get the results sooner when they are transported down to Fort St. John. And as noted by Dr. Mostert, with one of the tests that we're no longer able to provide there is the hemoglobin test, and the HemoQ has been purchased, and we anticipate that it'll be up and functional within 3 weeks. So we did decommission the machines, similar to other types of machinery. If they're not used, then the equipment will be damaged. And so we've decommissioned it so that it will stay in Fort Nelson, and they will be put back into service when we are able to get lab techs and recruit into those positions. Similar to the reagents are extremely expensive and they outdate very quickly. And so we've moved those reagents that we're not using up there and have sent them to other Northeast labs. And then once the Fort Nelson lab gets up and functional, then we will order reagents to be used at that time. In regards to recruitment, we have tried to request contract agency techs since July of 2021. And also to note that there is an incentive of $10,000 per full-time position in terms of the relocation allowance, as well as the relocation allowance. So I'll pause there for any questions.
So just to be clear, Angela, these positions have not been eliminated. Positions still exist. You're recruiting to fill those positions at our hospital, and you're providing a $10,000 bonus, I guess you'd call it, and a relocation allowance for techs to come to Fort Nelson. Is that correct?
That's correct.
And how long do you think it will be before we have lab techs in Fort Nelson?
It's hard to say. We may have to wait until the next graduating class for the lab techs, which is next, I think it's next spring to April. Fort Nelson has, with the benefit of the chief tech, that has helped to bring in individuals who are interested in getting more into the management side, as well as there's a higher rate, a wage by going into the chief tech. So that is something that we're anticipating would help to recruit as well to Fort Nelson.
Councillor Penny.
Hi there. One question I just wonder, I'm assuming that there would have been an exit interview with both these techs that decided to leave. And I'm just wondering if the results from that have been looked at to see if there was actually any problems here in town of why they wanted to leave. I mean, it just seems pretty strange that we would lose both our techs at the same time like that.
Yes, Northern Health does conduct or offer to any staff that are leaving, and we encourage them to do exit interviews. And I believe those are currently underway in terms of what are their reasons. One of the initial comments that has come up is in regards to the volume of on-call that they have to do. We have been down a lab tech for since Carolyn left, which is almost a year now. And so they're having to do the 1 and 2 versus 1 and 3 for on-call. However, we have been successful we've created a permanent lab assistant position and a second one of a Fort Nelson resident who's just completed their training and has moved back to Fort Nelson and wants to stay in Fort Nelson. So created a second position who are doing the bulk of the work at this time, collecting and packaging, and over time with additional training, there may be an opportunity for them to also take on call, which would help with that burden of on-call.
Annette, you had something to say. I see your hands raised.
Yeah. Yes, thank you. The one thing that we also do offer housing for a limited amount of time, either here at the residence or at the townhouse. So there is also that as well.
Thank you. And this is an added incentive for a tech that would be coming to Fort Nelson.
For anybody who is successful applicant, whether in the hospital or in the community health unit, it's for anybody.
Thank you. Councillor Gerwin.
Thanks, Mayor. Angela, I don't think I caught everything you said, but it was something about currently it's a 2.5 week for normal routine blood test. Do I have that right? I know you said 2.5 weeks. Is that to get the results back, or is that a 2.5 week wait to actually get an appointment to have whatever specimen drawn or excavated from the body or whatever?
Yeah, so thanks for that, Lorraine. Yes, we've reduced, I think it was right around 4 weeks or 5 weeks because of the added COVID precautions. And then with the creation of the new lab assistant position, we've been able to bring that down to 2 to 2.5 weeks for the collection of the specimen. And then once they're processed in Fort St. John or through the point of care testing, then the results will be the time that it just takes us to transport them to Fort St. John and then have those tests run.
So Angela, throughout British Columbia, I would say Prince George, Fort St. John, is there a 2.5 week wait to get blood drawn for tests? Is that what I'm hearing?
No, it's quite a bit longer than that. If we look at even Chetwynd, similar size facilities, or Fort St. John, they're at least 4 to 5 weeks. They're at about a 2 week for booking the test, but then the appointment is typically about 4 weeks out before they're able to come in and get those the specimen collected.
That's for the collection of blood specimens, is that correct?
Yeah, blood or urine samples. The benefit is we do have the X-ray technicians are able to do the EKG, so they may be able to get their heart tracing because we increased the positions from 1.5 to 2 full-time positions because of that work-life balance and the burden of on-call for X-ray techs. And so similar to other smaller communities, we looked at, okay, how do we fill their time? Because their time wasn't totally filled up, but it gave them a better work-life balance. And EKGs is one of the tests that they're able to provide.
Okay, Councillor Penny.
I'm just wondering, in the similar sized communities, is the longer wait, is it caused also from lack of techs, or is it just that they're so burdened with the amount of people that are looking for testing?
Thanks for the question. I think it's a combination of both. It is the workforce challenges and it is the number of patients being booked. And some of it is the ordering practices in terms of how many tests different physicians order different volumes of tests. And so it can vary. But prior to the 2 lab techs leaving, we were able to get down to that 2 to 2.5 week wait while we still had the 2 chief techs here. And we've been able to maintain it now with the second lab assistant supporting that work.
Okay, thank you. Are there any other questions before we move on? Okay, I'll get you to move ahead.
So the next slide is in regards to physician recruitment. And so we just want to acknowledge that physician recruitment can't occur without the involvement of the local physicians, largely because in order to recruit a physician to Fort Nelson, they will then work in the medical clinic in Fort Nelson. And so we, as Northern Health, can't say to the medical clinic, you're now taking on this new physician, or you need a new physician. So we, as noted here, as much as the physicians want to be part of recruitment, we encourage them to be part of that. There's also the provincial programs related to recruitment, the site visits, and they pay for all the costs of recruitment when done by the health authority. And so that is not previous to the health authority supporting this work. Individual clinics, when they were trying to recruit a new physician to their clinic, would pay out of pocket in order to do that, where if Northern Health Authority makes those arrangements, or another health authority, then those costs can be borne by the through this program. And then we also have a recruiter that's dedicated for the Northeast physician recruitment. well, does physician and nurse practitioner who assist with things that would otherwise fall on the individual physician or their offices if they did the recruitment on their own. The second slide provides a little bit of different additional information in terms of the fact that physician recruitment has become more and more complex provincially, nationally, and even internationally in the last 10 years. We've heard about the effects of, we used to get a lot of our physicians out of South Africa, and they changed their medical program, and it has had some impacts, particularly in rural northern communities, and this complexity is at times difficult to stay ahead of, and for a health authority with our team, and almost impossible for the individual clinics and physicians to know what physicians can gain license in BC when they're trained in another country. And then ensuring competence to provide the level of care required in Fort Nelson, and recognizing that the emergency department is not a core competency for all physicians. And so we do struggle with making sure that they're qualified in that way. The next slide is about physician retention. And there were some questions about what are we doing to retain physicians. So just in terms of physicians are compensated through the provincial physicians master agreement that the doctors of BC negotiate with the Ministry of Health. And I've just listed out a number of the retention benefits as well as the recruitment benefits that every physician being recruited in the province of BC, and more so when they come to the north in terms of the added retention incentives, as you'll see in the last bullet. And Northern Health has really worked to strengthen the support for physicians within our organization by creating quite a number of medical lead positions that are filled with physicians to make sure that they're actively participating in conversations about healthcare service delivery in the north. So I'll pause there if there's any questions about physician recruitment or retention.
Councillor Andrews.
Yeah, you're talking about a lot of issues you guys have been having with retention due to, I guess, the College of Physicians, parameters put into place that we need to meet. It sounds like we're creating our own issues, that BC is creating more and more issues and making it harder and harder to take care of our people because we can't get health experts. Is that an issue that you see directly from the College of Physicians, or is there one entity causing this issue, or is it a bunch of issues?
Yeah, thanks for that. I think it's a combination of issues. So the one related to South Africa, there was becoming such a mass exodus in South Africa that it was that country itself who said, we're spending all this money, we're training our physicians, and South African physicians are highly trained. They come out either as general practitioner surgeons or anesthetists. And so they are really desirable in rural communities because of that. But they weren't staying within their own country that had provided the training. And so that was their decision within their country in terms of changing their schools so that they could no longer as easily get a license to practice within BC or Canada as a whole. Some of the other ones would be a conversation with the doctors of BC in terms of what is the requirements and all the Commonwealth countries, your Ireland, your England, Australia, they're able to come across in terms of, because they all meet the requirements that are the same as the medical programs in Canada. And we look for both Canadian grads and then BC proactively has gone out with the IMG, the International Medical Graduate Program, as well as the PRA program, which is the Practice Readiness Assessment, in order to increase, and they've done that quite successfully in terms of increasing the number of physicians working in rural practice, recognizing that those programs have a 2 to 3 year return of service. And so we are seeing some that will stay. That's enough time to get them embedded in the community, but other times they're just staying for the life of their contract. And so it has allowed us to do more work with the Canadian grads in order to recruit and retain them in the North.
Thank you. Councillor Gerwing.
Angela, is the ING program, is that, so that's the program where people have been trained internationally and then they come to Canada and maybe have to do some repeat of whatever to get a license in Canada. Is that the one we're talking about?
No, the IMG program is based out of St. Paul's. And so they work through St. Paul's for 2 years. And then part of that is a return of service agreement. What we find is that most of those grads don't like coming north, similar to what we see with other healthcare providers. They'd sooner stay and work in the place where they've received training and they've got some confidence over the last couple of years with that. And so those grads are more and more difficult to recruit to rural communities. Whereas the PRA, those are the grads that we've seen in quite successfully in Fort Nelson, where they come, they do a 3-month assessment in another community, and Fort Nelson assesses them for other communities like Mackenzie, and we're able to keep them for 3 years and try to really embed them into the community in hopes that they will stay.
Councillor Gerwing.
So thanks, Angela. Just as a follow-up. So is there any opportunity around somebody that was internationally trained and is interested as a doctor and is interested in coming back to Fort Nelson? What hoops do they have to go through that would enable them to do that?
So that would be a question for the recruitment team. I don't know. It'll probably depend on the country that they receive their training. So if it was Ireland, it would be less difficult than another country that may not have that. But that, I would encourage you to maybe see about asking for a presentation by, with Dr. Becky Temple and the Northeast Physician Recruitment, because they're the ones that know which countries and any of those specifications.
Okay, thanks.
Any other questions about physician recruitment and retention? Very well, Angela, let you move on.
Just wanted to give you an update on the COVID-19 clinics. So as you can see, we've got COVID-19 and flu vaccine 5 days a week, with the exception of Wednesdays that are an extended day and to book appointments. And Northern Health Authority works very closely with the Fort Nelson First Nations and Prophet River First Nations in terms of sending our staff there when they're hosting clinics, and the Fort Nelson First Nations sends staff to help us when we were doing the mass immunization clinics, and then also Save on Foods within Fort Nelson also provides the Moderna vaccine, and we've appreciated all the support and the work with the district as well as the firefighters for those community clinics, and we're working with the firefighters and they're getting education. So when we start the booster doses for the general public in January, that they'll be able to come and help support us. And then I've provided the most recent update on the first dose and second dose percentages below.
Thank you.
The next slide just provides kind of the geographic information It's good to see that Fort Nelson area has now gone to an orange instead of it was at red for at almost a month now. So there's only the 2 new cases that have been detected up there from October 31st to November 6th. And then just a few more slides in terms of there's been talk about the service decreases, and we did reduce the clinical nurse educator to part-time, and as a result that enabled us to bring a retired nurse who was not interested in full-time work into that position, and she is now started into that position, which is great with all the new staff that we have to provide more at the elbow. So lots of tailoring of positions based on the staff that we have there and the staff we're trying to recruit. Similarly, the social worker was a full-time position. She had requested to drop down to a part-time because she's now got 2 children, and with the fact that that position has remained vacant while she's been on maternity leave, there's a 40% vacancy rate within the Northeast for social workers. We granted that. The money will stay there, so when things change and she then may be interested in full-time, then we'll change that position back to full-time. The ultrasound services, as noted, they've been fluctuating depending on availability of qualified personnel and the wait list. And then as noted here, the temporary lab service reduction.
Angela, those service decreases are over what period of time?
This would be in the last 2 years.
Okay, thank you.
Nursing recruitment. So in 2020, we had 17 difficult to fill vacancies, 12 of which were nursing. What we deem as difficult to recruit or difficult to fill are if they've been open for greater than 90 days. So also noted that over 50% of our workforce is under 3 years of service. So there is a higher likelihood of turnover, which we're seeing in lots of communities where, and I think it was noted at the November 4th meeting that individuals typically don't come and work for 20, 25 years anymore. This is a trend in terms of our workforce. There is a slight increase in leaves because of the younger workforce, largely due to maternity leaves. And then also increased retirements, which because of the workforce over the age of 55. However, since January, we've successfully recruited into 6 of the registered nursing vacancies and have done a lot of really great work. Annette and her team, as well as with the Northern Health Recruitment. And so there's only 2 permanent full-time vacancies remaining in Fort Nelson. One's a registered nurse and one's a licensed practical nurse. We're anticipating that the licensed practical nurse position will be filled in January because we have a new grad that will be graduating, looking to go into that. And the RN, we could fill it. Our challenges right now are the RN lives in the Northwest Territories. And because of the border restrictions is not able to come and do their shifts in Fort Nelson and then go back where their spouse lives. So we've, elevated that, but we're still working through that because of the COVID border restrictions.
So Angela, is it not possible for this person or Northern Health to apply for an exemption to that border restriction?
I'll let Annette answer that because she's been working with the medical health officers who've been working with the NWT as well.
Yeah, so we've tried many different avenues and with the exemption, but because he's not an employee there, they're not willing to grant that, and they're not willing to open up the highway for him to travel back when he's finished his his 4 shifts. So if he was finished on a Thursday, that would be okay because the highway's open. But if he's finished on a Friday, then he'd have to drive all the way back through Alberta, which is a 19-hour drive to get back home. So we have tried many avenues. They're still working on it. But at this time, they have said no to us.
Okay, thank you. So as far as nurse recruitment goes, what I'm seeing is that our pictures is not so bad. We're almost at full strength here, and maybe once the Northwest Territories drops its restrictions and we get into January 2022, we will have all our positions for nursing filled. Is that what I'm seeing here?
That's correct.
Okay, so the Northern Rockies and around the council table, we've said on a few occasions here where we would like to get involved in retaining some of the nursing staff that comes here, whether it is, finding out what their interests are in the community and connecting them with people that can share in that so that they have a social life here in the Northern Rockies. And by doing that, we can help to retain nurses in our community and do the same thing with doctors. So we would really like to get put in touch with some of the nursing staff or some of the doctors. And if we could identify some of their interests in the community, do some introductions, take them to dinner, do whatever it takes, to make them part of the community. What I worry about is that people will come to our community, they'll do their shifts at the hospital, they'll go into the nurse's residence and they'll sit there until their next shift. And, it's pretty hard to retain people that way. And we really want to get them involved in the community so that they stay here. So this is a big thing for me that, I think there's an opportunity here for members of our community to meet with these nurses and or doctors and really promote our community and everything we have to offer here. So we would really like to see that opportunity. Are there any questions on nursing recruitment? No. Okay. Was there anything else, Angela?
There's just a couple slides on service enhancements in terms of what we've been able to do. So the first slide is on the hospital. So we now have an occupational therapist part-time that works both in Fort Nelson Hospital and Fort Nelson Community, and also in Fort St. John, new grad, so is able to touch base in Fort St. John with the senior OT and then travels up to Fort Nelson to provide that service. Support services, we increased the food service workers to enhance the meal experience because we had quite a few complaints about the food. And that has resulted in reduced complaints and increased satisfaction, both by the residents and then also hearing from the family. As noted, we increased the second DI or X-ray position from part-time to full-time, and then also created 2 medical lab assistant positions, and the second one is to support the decrease in lab staffing to make sure that we've got the lab capacity there. So, and then there was some comment about the DI tech that went out for the ultrasound training. Both Lynette and I don't know why I'm calling you Lynette today. Annette and I talked specifically with that DI tech. He wanted to keep his options open. He was eligible for a number of financial incentives from Northern Health if he agreed to come back to Fort Nelson or another Northern Health community. And he just said no. He wanted to do his 2 years of the program and then see where the opportunities were at that time. So we do connect up with them. And also let them know about the Peace River Regional District healthcare scholarships, of which Fort Nelson has been receiving scholarships under that umbrella as well. And then the next slide is just on communities. So I'm not sure if the council is aware that we've now increased home support services to 7 days a week, including the weekends, but that also includes evenings. So before, home support was a Monday to Friday, 8 to 4 service. We were finding that there was increased need in the community. Individuals were having to come into hospital and wait in there for long periods for multi-level care when they wanted to stay within their homes. So we've been able to do that. We've also created a harm reduction peer support position that has been very well received out in the community with the community organizations as well. And then once again, for rehab services with the occupational therapist. And then the last slide is just about the rural retention incentives that we're working through with the recent Government of BC news release in terms of making the North more desirable and accessible. So increasing the travel resource program that we use in Fort Nelson. It gives an option for Northern Health employees not to quit and join an agency, but to stay with Northern Health and travel around Northern Health and gain experience and stay with us. And it's been quite successful. And then looking at some childcare, housing, and then creating some additional clinical management supports that build capacity to support our new graduates. So that's it for my presentation. If there's any further questions.
Thank you. Councillor Gerwing.
Thanks, Angela. Can you speak to if there has been any childcare initiatives presented for acceptance in the Fort Nelson community?
No, there has not. The working group is just starting to embark on this. And so they are now going to be, the first was to decide which communities there was gaps. And so they've been doing kind of an environmental scan, and then they'll be reaching out to both the community providers as well as the Northern Health staff in terms of what are they looking for in terms of childcare within their community, and then we'll continue to move that forward.
Does Fort Nelson have representation on this in this group?
Not on the core working group. There's one from one representative from the Northwest, Northern Interior, and the Northeast, and then those that working group will be having focus groups out in the communities, particularly the Northeast was cited as the key benefactor of this rural retention incentive. And so we will be looking at all of the 6 communities in the Northeast in terms of, Fort Nelson had some added new childcare spots. My understanding is that they're pretty well filled now. And so then it is looking at expanded hours of operation. We typically will do a survey to see how many of the staff currently working at the Fort Nelson Hospital and in community have children. And if so, what does that look like for them in terms of expanded hours of work? Are they working a Monday to Friday, or are they working shift work?
Yeah, just to confirm that those additional spots were for before school and after school. So yeah, they weren't full-time spots created. And so that's a huge concern for this community, and specifically for the hospital, that there is no after regular hours care in the community unless you're looking at a private provider.
Okay, thank you.
Mrs. McIver?
I would just add too that there are very limited spaces for children under 3 in the community. So like 0. Which is, if you're, attracting those employees back who are just returning from leave, that makes it really difficult.
Thank you. Are there any more questions for Mr. Smit? Councillor Penny.
Hey there, Angela. I'd like to thank you, by the way, for getting this presentation ready as quickly as you did. One question that the general consensus, I would say, of residents I speak to about healthcare in Fort Nelson are very fearful over the trend that is happening at the hospital. And it seems like we're losing more services than we gain. I just wonder if it was the long-term plan for Fort Nelson Hospital, if we were to take the personnel retention part out of it, if we were able to get workers when we needed them, would the long-term plan of Northern Health be to increase services at the Fort Nelson Hospital or to decrease services over time?
I would say that the long-term plan is to look at increasing or sustaining those services. And it may not just be at the Fort Nelson Hospital, it's in terms of community. What we're seeing is individuals want to stay in their homes and want to stay within the community. And so a couple of the challenges that we've encountered that you're well aware of is in terms of the current economic state of Fort Nelson, and that we're using the pros in terms of housing and cost of living, in terms of recruitment, in terms of getting individuals there where it may be not as financially favorable to them, so that we can look at those types of things in terms of having a full workforce that would allow us to look at the services we're able to provide and if there's opportunities. The other thing, as noted under the physician recruitment, is that all physicians now do not do the same well-rounded medical services that they used to do. In terms of it, it was only maybe 20 years ago that physicians coming to a community were expected to do emergency care, maternity, and do on call, all of those types of things. And we do not see that in terms of services. We work with the physicians and, we looked at the Haida Gwaii model with the low risk maternity, whether that was an option that we could bring to Fort Nelson. But at the current physicians in Fort Nelson felt very apprehensive about doing low maternity without an immediate surgical backup. And so we have to respect their decision, because they are the medical professionals that are ultimately caring for those maternity patients. And so if there's opportunity or different healthcare providers that are able to come into Fort Nelson, our key thing right now is maintaining the core services that we have, which includes the emergency department, the inpatient unit, the multi-level of care, and the X-ray and lab department, along with the increasing telehealth support to reduce the amount of travel out of Fort Nelson.
Thank you. Any other questions? Councillor Gerwin.
Yeah, so I think, I want to just echo Councillor Penny's gratitude for you coming before us today and making this presentation. I think what I hear in the community is that there is a decrease in service levels, and not only the services that you can access at the Fort Nelson General Hospital, but it's in terms of getting a diagnosis. So, we have to travel out for everything, any kind of cancer care or pretty much any kind of treatment for more than just the basic, stitches on your finger or, well, I really should be careful, but what I'm trying to say is, like, when we can't access services in our hospital and we have to wait 2.5 weeks to be able to get an appointment to even give blood or all of the other stuff that the lab handles, and then wait for the results even longer, that never used to be our reality. And I know that COVID has changed a whole pile of things, but the community really feels like this is a continuing decrease in services, not being able to get a CT scan here. And I think it's over 500 CT scans that had to leave the community to be done. And the list goes on and on and on. And it's at the cost of residents. And they're paying for that themselves at a time where it's burdensome for people to find that money to make repeated trips down the highway in, like if you could see the weather today, I was thinking I'm really glad I don't have to be going out for any testing today. So that's the feeling within the community. And I understand from your perspective, and I appreciate the perspective that there are good things that are happening at the hospital, but wondering how the municipality or mayor and council can play a role in addressing the concerns that residents have that Northern Health doesn't necessarily share, i.e. waiting 2.5 weeks to get an appointment at the lab.
Mrs. De Smit.
Thanks for that. I think we are working to maintain the current services, and I fully understand that individuals would like to be able to come and do the waits like they did previous to COVID during the time for their outpatient, where they would just wait in the waiting room until such time they were able to, the lab tech or the lab assistant was free to collect the blood. But at this time, because of the lower vaccination rates in particular, the fact that we're seeing, the cases are still there and the spread, and that also results in health hazards and transportation out of the community because of the COVID. We need to make sure that we have due diligence when individuals are coming into our facilities to make sure that we're not, that there's not that additional spread that or transmission that we are very concerned about. And I think it's in terms of, so if tests are ordered urgent or emergent, then they, similar to x-rays, they are then increased in the queue in terms of when those tests are able to be collected and the results are done. But when the physician, and in consultation with the physicians in terms of, what is routine, then this is within, and I can appreciate that, the individuals within the community of Fort Nelson would like, a same day or next day service. But at this time, we're just not able to provide that in terms of the lab services. And we have steadily improved it from, where we were even 4 months ago in terms of the 4 to 6 week down to the 2 to 2.5. And we're going to continue to work to improve that. And particularly when we're successful in getting hiring into those vacant lab tech positions. And yes, CT scanning has become a standard for diagnosis, and we are working towards that in terms of the business case, recognizing that we need to know if it's going to cost us $700,000 or if it's going to cost us $400,000 in terms of just making sure that we're able to secure the funds and put those into place. And then fortunately, the x-ray techs that you currently have with some additional education, like we've seen in Dawson Creek and Fort St. John, are able to then be able to do the CT scans. So it's not like ultrasound where they have to then go out for 2 years to take a new program, or an MRI tech is 32 months of online training to go from an x-ray tech to an MRI tech. So, those are things that we are putting in our plan and working forward in terms of increasing those services in Fort Nelson.
Are there any other questions for Mrs. De Smit? Okay, Angela, I would like to thank you for making that presentation today and giving us the perspective of Northern Health on our healthcare issues here. I personally would like to see you do this about every 3 months to keep Fort Nelson advised of what Northern Health is doing in our community, keep us up to date, and maybe advise us of anything that is not going well that the Northern Rockies can help with. I appreciate, you saying that the Northern Rockies has, helped Northern Health in achieving some of its healthcare goals in our community, including our fire department, our first responders. So if that's all and you have nothing to add, I will thank you for your presentation today.
Thank you for having us.
Is there anything else, councillors? Hearing none. This meeting is adjourned.